Although microbiology is clearly recognized as an important part of scientific research, it can be difficult to see how it affects professional jobs on a larger scale. In this virtual field trip, we explore how UF's Veterinary Diagnostic Lab utilizes microbiology.
I am currently the lab manager for the veterinary hospital at the University of Florida. And here we primarily focus on helping clinicians diagnose and treat infectious diseases in a variety of species of animals. And so that may include general microbiology techniques as far as culture plating, ELISAs, IFAs, etc. So on a daily basis, we get samples for aerobic cultures, fungal cultures, parasitology samples, as well as serology send-outs. And so what we have to do is, based upon the request, we figure out the next step. So if a request comes in for an aerobic culture for urine, we have a specific protocol that we use so that we can give the clinician a quantitative analysis of what is in the urine, as well as an identification. And we even go a step further as to providing the sensitivities. So once we get the ID, we can put it into our automated machine, find out what the organism is sensitive to, and then help the clinician treat the infectious disease.
I am a DVM. I studied in Argentina, and then I did a post-degree in microbiology in Argentina also. I think bacteria is fascinating, and seeing the bacterial population on the same patient, sometimes the veterinarians ask to have more than one organism work on the same sample, and you can see the resistance patterns that are similar sometimes, and it's amazing. It's amazing.
So this is our parasitology bench. Parasitology is the study of parasites that infect, for our purposes here, canines, felines, bovines, etc. One of our most routine tests is called the fecal flotation. And so what we do is the clinicians will send us a sample of poop here, and so what we do is we add Sheather solution to it, which is just a flotation solution, so it has a certain specific gravity that's greater than the egg. So the eggs, when we centrifuge them, will float to the top. And so once they float to the top, we take a glass microscope slide cover, like so, and we put it on top of our tube of poop, and then we put it on a slide, and then we read the slide. We scan the slide for any kind of parasite eggs, and if we do find an egg, we try to identify it to the species level if we can. And we have a variety of reference books to help us in our identification. And so after we identify a specific parasite, then we call the clinician so that they can immediately start treatment. So this is our serology section. And here we perform a lot of our tests that we don't use culture plates for. So our samples are usually serum or CSF samples. And just a representative of some of the tests that we do are IFAs. And for IFAs we use substrate slides that has the organism on it. It looks like this. And so what we do, if the sample has the organism of interest, so for instance Toxoplasmosis gondii, we use their serums. We incubate their serum on these test slides, and we go through a series of washing and incubation steps. And on the last step, we look at the microscope, and if we have anything that fluoresces that looks like Toxoplasmosis gondii, then we call that test positive. So those are our IFAs. We also do a lot of latex agglutination tests. One example would be Cryptococcus antigen tests, and for here the samples are usually serum and CSF as well. And so basically, if your serum has the Cryptococcus antigen in it, it will agglutinate on this test. And lastly, we do ELISAs, and one of the ELISAs that we do most often is equine infectious anemia, which is it's caused by a virus that only infects horses. And so we do a lot of those tests to make sure that horses are not being infected, crossing state lines, etc. And so it's a basic, very easy ELISA. It's an indirect ELISA. And this specific test takes about 15 minutes to run. So that's the majority of what we do here in serology. So this is our mycology section, and in our mycology section we study filamentous and unicellular fungi. The unicellular are the yeast, and the filamentous are the mold. A clean plate will have no organisms on them. So we check our cultures for once a week for 4 weeks. And so we always give a preliminary. If nothing's growing, we say no fungus growing at relatively 9 days. But those that do grow mold cultures, we immediately wrap them in parafilm and we put it in bags because we don't want anything getting out in the lab. And so this is a mold culture that we grew here in the lab. I'm not sure what the specimen is of, but it's really pretty. And so we would go through normal tape prep, a microscopic ID, and if the clinician wants, we also do fungal susceptibilities as well. So we get a sensitivity from this organism.